Hello and welcome to Wellbeing. I'm Oliver Croft. Today on the show, we'll be taking a look at the discipline of pharmacy and how pharmacy services can contribute to the well-being of the community. To give us an experienced and passionate view of this topic, we'll be speaking with pharmacist and PhD candidate at the University of Newcastle, Chelsea Felkai. Chelsea owns My Village Pharmacy in Whitebridge and Redhead Pharmacy and is the Director of Cognitive Pharmacist Consultants, the CPC, delivering medication review services to individuals at high risk of medication misadventure, particularly those living with a disability. Chelsea, it's a pleasure to have you join us today on Wellbeing.
It's a pleasure to be here. Thank you.
We'll be diving into some specific topics about the role of pharmacists in supporting the well-being of their community. But firstly, you're a PhD candidate at the University of Newcastle. How is that coming along for you?
Oh, it's interesting. I am just about to submit, so it's been a long journey, but I'm excited to finally reach the end. It's been a lot of work in looking at how pharmacists can support people with intellectual disability in the community.
We wish you all the best with that, Chelsea.
Thank you.
So if you could tell us in broad terms, how do pharmacists serve their community?
Well, there's a number of ways that pharmacists are embedded within healthcare generally. So I think the most common place that people will see their pharmacists will be within a community pharmacy. So nearly every community across Australia has got a community pharmacy where people can access their medications, and they can also go in there for health advice. So community pharmacists play a really fundamental role within our primary healthcare system, largely because we are so accessible. You don't need an appointment. You can walk in off the street. And what a lot of people, I think, I'm finding recently and hearing more and more is that people are increasingly surprised with the range of services that pharmacists, particularly in their community pharmacy, are able to provide, because it has been increasing quite rapidly in recent times. So apart from dispensing your prescription, as most people would be aware of, that a pharmacist does, pharmacists are also able to vaccinate quite a broad range of vaccinations, immunisations such as the flu vaccination, the COVID vaccination, amongst other sort of travel vaccines as well. And that's all sort of been brought about with COVID, obviously us needing to get the vaccines out to the population, and pharmacists were a really valuable part of that delivery. Other services that pharmacists provide that people may not be aware of is something called a meds check. And that is where someone who might have more complex medical conditions or be on a number of medications can go in and talk to their pharmacist about those medicines and actually have some one-on-one time and really quite thoroughly go through their medicines one by one to ensure that you understand what those medicines are being used for, how you're using those medicines, and often the pharmacist can provide a few tips and tricks around, using those medications in an easier way for patients, and answering lots of questions that you might have around the side effects of the medicines or whether those medicines are working effectively for that person. So I think that is a really a good sort of service that lots of people aren't aware of, and it's completely free for those that are eligible.
Okay, so would you say that's one of the biggest advantages pharmacies hold over the community, is how accessible and free they are?
Yeah, absolutely. A lot of the services are free, and I think it's increasingly difficult to get into different healthcare providers. We are seeing with an ageing population that there's more strain on the health system. So I won't be the first to say it can be quite difficult to get in a timely way to get to a GP appointment, where pharmacists, you can walk in off the street and get some advice. And that advice might be to go and see your GP, but at least then you've got that confidence to say, okay, well, I've had it looked at. I know that the GP is the next point of call. Or actually, let's try and use this cream or this product, or I'll use this self-care advice, maybe put a heat pack on it. And if it doesn't go away within a certain amount of time, then I know to go to the GP. So it's a really great way to access information, health information and advice.
In terms of medication safety and management, medicines are very widely used in our community for short-term and long-term health conditions. Could you tell us, how do pharmacists ensure medicines are used safely and effectively?
Again, within the community pharmacy, every time we dispense a prescription, we are checking that that prescription is safe and appropriate for that person. But there are more in-depth ways that we're able to do that as well. So I did mention the medication or the meds check, which is a sort of a smaller service within a community pharmacy that can occur. But there is also something called a medication review, which it needs a referral from the GP, and it's a collaborative service that a GP and a pharmacist conducts together. And so a GP will provide a referral for a pharmacist to actually attend someone's house and go through those medications. And this is a much more in-depth version of a meds check. So that's where we look at medication interactions, and we might look at whether the medications that are being used are the most appropriate for the health condition that the person has, and that everything is working safely and that they're being taken the right way, and providing a lot more advice and information and resources during that time. So that's a very in-depth version of how we can provide that best practice around medication use and safety. And after that service has been conducted, where we spend about an hour with a person in their home, we will then write a report that goes to the doctor, and between the doctor and the patient, they'll work out if any changes to the medications need to occur to make them either safer or more effective.
You've just talked about how the doctor and the pharmacist can confer. Are there different ways that the doctor or the pharmacist can involve patients in the decision-making about the medications they're taking?
Yeah, so I think one of the biggest challenges that I have found with particularly doing medication reviews in the community is that there is something called a case conference, where a GP and a pharmacist might talk together, and my preference with case conferences is to include the patient in that process. However, it's not always easy to get a pharmacist, a doctor and a patient all together at the same time. There definitely, I think, needs to be more work done around making sure that it's a more patient-centred approach. I think with the pharmacist working one-on-one with the patient and the GP also working one-on-one with the patient, even though the pharmacist and the doctor might have some discussions or have a report sent between them, the patient is still always involved in those, in the decision-making around what happens with their medicines. So even my purpose, the way I see my purpose when I do these medication reviews, is to say, this is the information, and this is what my recommendation might be based on that information, but it's really up to you as to what you would like to do, and I'll make that recommendation to the doctor, but I'll also include whether you actually are interested in that or not. So I might be speaking about something like, something we all know that smoking is bad for the health and can, worsen chronic health conditions. So I might say, well, my recommendation is clearly going to be to try to reduce smoking. But if that's not something that's on your agenda, I will also include that in the report too. So I always try and make it sure that it's about the patient and what their priorities and needs are.
Okay, so what I'm gathering there is that the patient is the priority.
Yeah, they need to be at the heart. It's their health. So it needs to be what their decisions are.
So owning your own pharmacy, My Village Pharmacy, how do you make a safe, approachable space?
Yeah, this is an excellent question. So the first thing that I find that makes a good pharmacy is the staff. I think the staff are the heart of a pharmacy. So making sure that the staff are happy and healthy and that they have good knowledge, and that they're always making sure that they're welcoming our patients, our community members into our pharmacy is priority number one. I would never want someone to come into the pharmacy and feel like they don't belong or feel like they are too afraid to ask any question that might be on their mind when it comes to their health. So I think a lot of it comes down to ensuring that supportive environment is there. And we also try and make sure that it's the same staff that are there. I've got very long-term pharmacists. I'm often in there because we've built relationships with members of our community that allow them to feel safe and welcome, and will ask the questions that might be pressing on their mind that they might be afraid to ask other people or other healthcare professionals.
You're listening to Wellbeing. My guest on the show today is Chelsea Felkai, pharmacist and PhD candidate at the University of Newcastle. Obviously, there are some things that pharmacists can see, such as maybe a rash or they're a bit under the weather, but obviously there are some illnesses that pharmacists can't see, such as mental health or diabetes. How do pharmacists combat these?
So I think in a similar way as what I mentioned around that relationship development. So making sure that our places, the location is a safe space for people to come in and speak about whatever might be on their mind. So I've had numerous incidences where people have come in, and even if it's often people that I will see regularly, and because you've developed this relationship, you can often actually tell that when something's not quite right, when they seem a little bit off, they're not themselves. And there's been times where I've said, do you want to just jump into our private consult room and we'll have a quick chat? Like, something doesn't seem right. It's fine if not, but, I want to know how you're doing today. And we also have a little bit of an advantage of obviously knowing what medications are coming through. So we know what medical conditions people have. So therefore we can actually keep a bit of a closer eye on those people that we know might have mental health conditions and, might need medications adjusted, or, I can sort of give them a light. Hey, have you been to the doctor recently? I'm worried about this. Or, do you want to have a chat about it?
So Chelsea, what kind of health conditions can pharmacists screen for in a community pharmacy?
So I think our bread and butter in terms of health conditions is mostly your minor ailments. It's largely things that people will come in off the street and say, hey, I've got this rash. What is it? And I'll be the first to say that anybody that comes in and says, I've been bitten by something, what bit me? I don't know, but I do know how we can fix it. I know how we can treat it. So I think that often it's screening and managing those lower level things. And again, that's a good thing to try and keep pressure off the doctor's system to allow them to deal with more complex and severe health conditions. There are other health conditions, though, that many pharmacies will screen for. So there are ways for us to screen for cholesterol. So if someone's got high cholesterol, or screening for blood glucose to check for diabetes, and for blood pressure and things like that. So we are able to do a little bit of, some screening around that, but our ultimate aim would be to refer them to the GP for that to be further investigated.
You've said earlier in the show about how pharmacists play a role in vaccination programs.
Yep.
In particular, what is the role of pharmacists in vaccination programs for the flu?
Right. Well, that's only a recent development. We've been able to do the flu vaccine for quite a few years now. I'm going to take a stab and say at least 10. However, only recently have we been able to provide the flu vaccine from the National Immunisation Program. So just to be clear, up until the last year, we could provide a vaccine for the flu, but it had to be paid for privately by the patient. So anybody who was eligible to get it for free would have to go to their GP or another health clinic in order to get it through that free mechanism or through the NIP, the National Immunisation Program. But this year we've actually been allowed access to provide the flu vaccine through the NIP as well. So people can come in off the street and provide the flu vaccine for free for those who are eligible. So those who are 65 and above, or who might be pregnant, those types of people will be able to get it for free, and now we can deliver it for free as well. So that's been a really big advantage to increase access to those people that really should be getting it. The reason it's free is because they're at higher risk of severe disease from the flu. So we want them to have it, and now it's even more accessible because pharmacists are able to give it without an appointment, just walking in off the street.
And that's a really big advantage to the community as well, especially at this time of the year when we're in the middle of flu season.
Absolutely. And people often ask me, especially around this time in the flu season, they'll say, oh, is it too late to get my flu vaccine? And the answer is it's never too late to get your flu vaccine. The peak of the season is actually around September. A lot of people will think, oh, winter's almost over. We've only got a month left. But that's a long time, and there's plenty of opportunities for people to pick up the flu. And with the peak being in September, if you think of it, go and get it. It's as easy as that.
Okay, that's a great message. Beyond prompting safe medicine use, how do pharmacists promote healthy lifestyles?
Yeah, again, fantastic question, because I like to think of particularly the community pharmacy as a health hub. It's not just about medicines, it's also largely about information. We are there to provide information and education around anything to do with health. So a lot of the times we've got opportunities to talk to patients around whether it's somebody coming in to buy nicotine replacement therapy products, and to talk to them about their quitting smoking journey and giving them tips and tricks and connecting them with the Quit line and any other resources that might help support that decision that they've made around their health. And the same thing will happen when it comes to weight loss and opportunities to increase exercise and well-being. So a lot of people will come in and say that, I guess as an example, like I'm feeling really run down, I'm feeling like my health isn't where I want it to be, and we can have that chat around whether it's something as simple as introducing more exercise into their life or something around adjusting their diet. We've actually got a lot of training when it comes to managing or helping to support people with their lifestyle, a healthy lifestyle rather than just medicines or products to help fix a problem. We do like to think of it as a much more holistic approach.
In terms of digital health and innovation, how are e-prescriptions changing pharmacy practices?
Oh, I love e-scripts so much. I mean, I was just as afraid as everybody else when e-scripts first got discussed. I mean, it's a big change, and especially in pharmacy. And it happened. It was actually fast tracked during COVID, rightly so, because it did help to expand the access of prescriptions. But it was just another thing on top of a really hectic, chaotic time where we were constantly trying to get on board with new things that were coming out all the time. So to me, I found it really daunting at first, but honestly, after using it for, I think, about a week, I just fell in love. So it can be a little bit tricky, I think, for patients to navigate, to get their head around the way that e-scripts are used. And I'm not going to lie, the more scripts you have, the more confusing it can be if you don't have like a good system in place to manage those e-prescriptions. So quickly, a few of the benefits of e-scripts are things like you'll never lose it, ever. You cannot lose an e-script. If you lose a paper script, it's gone. I cannot help you. But if you lose an e-script, it still exists in the cloud, and I can find it for you. So I think that's one of the biggest benefits. Even when people say, I don't know where it is on my phone, it's somewhere in my emails or it's somewhere in my messages, don't stress, we'll find it for you. And the other benefit is that because it doesn't rely on that physical object, like a piece of paper, it can easily be sent from doctor's surgery straight to the pharmacy, or I can even send it from my pharmacy to another pharmacy. So it's a much more versatile way of ensuring that people can obtain their medications no matter where they are. So those are a few of the benefits. In order to try and manage, especially if you've got a number of e-scripts, and so you'll have these text messages coming through with a different QR code for your different repeat, and you've got 5 different medications, the best thing that you can do is get what's called like a script wallet. There are apps that help with script wallets, and most community pharmacies can help you to actually link up to a program that will allow people to keep their scripts all in one place. And that will literally just keep the most current QR code for that medication in that script wallet. And you can very easily see what the script is for and how many repeats you've got left. So I think that just things like the product like e-scripts have come out, but without a lot of information for patients to be able to understand how to manage the e-scripts. But again, pharmacists can really help. You just go in and ask any pharmacist and they would be able to help you with how to best manage it.
Do you have any recommendations of apps that could help with your script wallets?
I mean, the biggest one that I think would be used in pharmacy is MedAdvisor. It's a program that links with many community pharmacies that use MedAdvisor. So it acts like a script wallet, but one of the other things that I like about MedAdvisor is you can actually order your scripts. You can link to a pharmacy and order your scripts through that app, and then it tells you when the script is ready. So if it was linked to my pharmacy, I would get an alert through MedAdvisor to say that one of my patients has requested a script. I'll get it prepared for them, and then I send a little message back saying it's all ready to pick up. You can even pay through the app. And I mean, we can even organise delivery as an example, and you never have to leave your house. So there are a few apps that are similar, but most pharmacies that I'm aware of use MedAdvisor. And again, you walk into whatever your community pharmacy is and talk to them about the options available, because most pharmacies will have that as an option.
Can telepharmacy improve access in rural areas?
Pharmacy and pharmacists don't have a lot of access to telehealth. As an example, during COVID, I was able to provide medication reviews through telehealth, so I would be able to undertake that interview or that consultation with the person either over the phone, or I could set up an appointment online and we could talk face to face through the screen. But almost immediately after lockdown was lifted, the government retracted that, and we no longer are able to offer telehealth. And I think it's one of the biggest shames that has, when we're looking at digital technologies to improve access for people, particularly in rural and remote locations. As an example, my focus is on people with intellectual disability, and that's my specialty. So I had a lot of people that were wanting to access my knowledge and services, but that were from very far away. And I had to actually stop providing those services to those people because they were just too far for me to travel based on the funding that was available through medication reviews, and I was no longer able to do telehealth. So there's not really anything available that I'm aware of that's telehealth related for pharmacists.
Chelsea, as a pharmacist, are there any new technologies shaping community pharmacy or are on the way to that you're excited about?
I guess that's a difficult question in terms of there's nothing that I can think of that's big or groundbreaking, because everything that we're getting is sort of in dribs and drabs. I think the only thing that I've got my eye on at the moment, which I think the whole world has, is AI. Every single industry has been asking themselves, how can AI be used within my workplace? And I guess on the darker side, how is AI going to replace what I do? I'm very positive around AI. I think that it is there as a tool, and it could really be able to help create a lot more efficiencies within the pharmacy space. I've always felt that our role in physically dispensing and labelling boxes is not something that I value in terms of spending 4 years plus an internship and my knowledge base. I want to be out there talking to my community, talking to the patients and really giving them information. That's what my job, the way I see my job. So if AI can help to support in any way with me being able to gather that information to give to people, I I think, and this is just like spitballing, if I could have a discussion with a patient that could then be put into text and just they can take that home with them instead of me writing a very scribbled note at the end of, the things that we discussed to help them to remember, that to me is a real benefit. So these things haven't come into being yet, but I do see that in the future for pharmacy as a way of basically helping us to get all that information from our head to create resources and help the patients to understand that when they also get home. And then, of course, we've seen a lot of changes, such as the e-scripts. As I said, that's fundamentally changed the way that pharmacy views prescriptions and is able to open up access to patients. So I think that we're seeing lots of changes and within the digital space, and there'll definitely be more to come, what a sense.
Thank you, Chelsea, for joining me today. Your insights to pharmacy were very informative, but also incredibly valuable for our listeners. So it's been a pleasure having you on the podcast, and thanks for sharing your time and expertise with us.
No worries. Thanks again for having me. Really appreciate it.
I've been speaking to Chelsea Felkai, pharmacist and PhD candidate at the University of Newcastle. She owns My Village Pharmacy in Whitebridge and Redhead Pharmacy, as well as also being a director of Cognitive Pharmacist Consultants, otherwise known as the CPC. I'm Oliver Croft, thank you for listening, and all of us here at Wellbeing wish you well.